Thank you. ADCs are shaping the treatment landscape. In your opinion, what is the core focus in the race for next generation ADCs? Higher efficacy, lower toxicity, or broader target indications?
That's a very important point that you're mentioning, talking about the toxicity of the antibody drug conjugates. Over the last 20 years, the vision was always that we would want to have therapies that are more effective and less toxic. And the antibody drug conjugates don't really fit into these requirements. They are very effective. We have a super effective treatments in introducing the ADCs. However, they come along with a substantial toxicity. And while that's a concern and heavily under discussion in the metastatic setting, of course, in the early breast cancer setting, where we're making therapy decisions in order to improve the cure of breast cancer. So we have patients that can be potentially cured. I think we're willing to accept higher toxicities with which the antibody drug conjugates come along in order to benefit from the efficacy. So in the early breast cancer setting, of course, we don't want to have very toxic treatments, but we would be willing to accept somehow higher toxicities if that comes along with higher cure rates. But these studies are still going on. We cannot tell yet in how far the antibody drug conjugates in the triple negative setting and or other subtypes improve the overall survival. So therefore, I cannot really answer your question maybe to complete satisfaction, but in general, with the ADCs, there are some highly effective new therapies available for clinical trials in this moment. But if approved, of course, the hope is that the toxicity or the acceptance of the toxicity of the treatment pays off, and there might be some less patients that die of the breast cancer. But that's to be shown in the clinical trials that are being conducted in this moment.